I work with the WHO, the World Health Organization. I'm a medical epidemiologist. WHO was formed in 1948, and it's one of the oldest United Nations agencies. And its primary objective is to improve the health of the world's health. What it does is it provides guidance for the member states, it provides recommendations, and it also monitors and evaluates how we're doing in terms of our international health situation. What we do in terms of HIV/AIDS is that we help provide the policy and the strategy and also monitor our response to the HIV pandemic. What I do is I actually synthesize my background in internal medicine, clinical medicine, and also in my public health training. And what I do is I use that to work collaboratively. Public health is a team sport. Work collaboratively to develop guidelines and recommendations and strategies on how to best prevent HIV and tuberculosis, both of which are related to each other. I think I've grown up with HIV in some way. In my early training in the late 80s at Stanford Medical School, HIV was all around us. I lived in San Francisco. The epidemic there was devastating. And I think the turning point for me was when I was working in Uganda. I worked briefly in Uganda, and this was in the early 2000s. They knew that we had treatment in the West, but they didn't have access to it. And so they said, well, when's the treatment coming for our partners and our children mainly? They were more interested in keeping their families alive. And at that point, I thought, well, okay, I think it's time for me to dedicate myself to trying to expand access to treatment. And I like to think that over the next 10 years or the next period of time, we'll see another inflection point, another transition where actually treatment becomes part of the solution to the HIV problem. Thanks to PEPFAR and thanks to a lot of other efforts, we really have changed the face of HIV/AIDS. And I'm much more confident now than I was, let's say, 2 years ago, that we have the tools to actually turn around the epidemic and maybe even eliminate it in some settings. But actually, in the end of the day, it's extremely rewarding, and there's probably nothing more important to us than our health.